The Australian Physiotherapy Association has submitted this motion to the 17th General Meeting of the World Confederation for Physical Therapy. This video is to provide some background information about PEDro and why it is important to support the motion so that PEDro can remain a free, robust, global evidence resource for physical therapists. PEDro is the physiotherapy evidence database. PEDro contains reports of randomised controlled trials, systematic reviews and evidence-based clinical practice guidelines for physical therapists. Physical therapists need PEDro so they are able to rapidly find high-quality evidence if they are to practice evidence-based physical therapy. The PEDro website is available in English, Chinese, Portuguese, German and French. Physical therapists can search for evidence to answer their clinical questions using a number of search fields. For example, a search for evidence on the effects of strength training for men with prostate cancer returns 21 reports, which are ranked by method, guidelines, then reviews, then trials. A unique feature of PEDro is that all trials are rated for quality using the PEDro scale. These ratings are used to rank the search results. This means that physical therapists can quickly distinguish between trials which are likely to be valid and interpretable from those which are not. Clicking the hyperlinked titles gives the user the citation details, a breakdown of the PEDro score, the abstract and a link to full text. The evidence indexed on PEDro is published in 34 different languages. 10% of reports are written in languages other than English. After English, the most prevalent languages are Chinese, German, Dutch, Spanish, French and Portuguese. PEDro has operated continuously since 1999. In the May 2011 update, PEDro contained over 19,000 reports of trials, reviews and guidelines evaluating the effects of physical therapy interventions. The amount of evidence is doubling every 3.5 years. PEDro is used by the international physical therapy community with users from over 120 countries. The 17 top users are illustrated in this pie chart. The top 5 countries using PEDro are Australia, the United States, Brazil, Netherlands and Italy. This graph illustrates how many PEDro searches have been performed every day since 2007. Over the past 12 months, over 4,600 searches were performed every day. Remarkably, PEDro is used to answer a clinical question every 20 seconds. PEDro was developed and is maintained by the Centre for Evidence-Based Physiotherapy at the George Institute for Global Health on a not-for-profit basis. It cost about 180,000 Australian dollars to maintain PEDro in 2010. The cost to maintain PEDro increases by about 10% per annum. PEDro is funded by one-off competitive grants from Australian-based organisations, mainly from health, insurance and government agencies. We also receive ongoing per capita funding from 16 WCPT member organisations. One WCPT member organisation, the American Physical Therapy Association, sponsors PEDro as a major partner. 15 other WCPT member organisations sponsor PEDro as association partners. A sustainable funding model for PEDro cannot involve charging users and should involve contributions from the physical therapy profession, the private sector and the public sector, both in health and education. PEDro is an important global resource for the physical therapy profession. Without the support of the physical therapy organisations across the world, PEDro is unlikely to remain viable in the long term. The The motion to be put to the general meeting is the WCPT strongly recommends all member organisations establish an annual grant to PEDro, possibly based on a formula linked to membership numbers. Please consider supporting this motion.